All right, let's dive into one of the most fundamental procedures in all of clinical microbiology. I'm talking about something that's fast, super powerful, and gets done every single day in labs all over the world to help guide life-saving decisions. Yep, this is your masterclass on the clinical gram stain. And look, that is not an exaggeration at all. I mean, think about it. A procedure that's been around since 1884 is still the most critical test in a modern lab. How crazy is that? Well, there's a good reason. In just about 5 minutes, it gives doctors that first, absolutely crucial piece of the puzzle they need to start identifying and treating a bacterial infection. This isn't just some abstract test we do in the lab for fun. It has an immediate impact on patient care. It is literally the fastest way to classify bacteria, and that directly tells a doctor which initial antibiotic they should probably use. We're talking about getting that critical info in hours instead of waiting days. And its versatility? It's key. We use it on pretty much everything: sputum, urine, blood, even cerebrospinal fluid. So you might be wondering, how does one simple stain do all of that? Well, it all boils down to a fundamental difference that basically splits the entire bacterial world in two. And that right there, that's the whole foundation of the test.
And here it is. The whole principle hangs on the structure of the bacterial cell wall. So you've got gram-positive bacteria, which have this really thick, absorbent layer of something called peptidoglycan. A good way to think of it is like a thick sponge. On the other hand, gram-negative bacteria, they've got a much, much thinner layer of that stuff, plus it's covered by an extra outer membrane. And that one little architectural difference, that's what makes this whole thing work.
Okay, so here's what that looks like in the end. Because of that thick, spongy wall, the gram-positive guys hold on to that primary purple dye. But the gram-negative bacteria with their thin wall, nope, they can't hold it. The dye gets washed right out, and then they pick up the pink counterstain. So the takeaway is super simple. Purple equals gram-positive, pink equals gram-negative. That's the color code every single time.
Okay, so we've covered the why. Now let's get into the how. We're diving into the practical part of this masterclass, the actual step-by-step staining protocol. And trust me, this is where your precision and technique really, really matter. First things first, before you even think about starting, you've got to get your workstation set up right. You'll need your clean slides, a heat source to fix the specimen, and then your 4 key reagents. You've got crystal violet, that's the main purple stain. Graham's iodine, which basically acts as a mordant to lock that dye in place. Then the decolorizer, and we'll talk more about this one, it's critical. And finally, safranin, the pink counterstain. And of course, you'll need water, blotting paper, and your microscope all ready to go. All right, step 1 is absolutely foundational. You have to make a thin smear. I can't stress this enough. If it's too thick, you're just not going to get a good result. Simple as that. Once it's air dried, you heat fix it so the bacteria actually stick to the slide. Then you're going to flood the slide with crystal violet for a full minute. That's what stains everything purple to start. After a quick rinse, you hit it with Graham's iodine for another minute. What this does is it forms this big di-iodine complex inside the cells. Okay. Listen up, because everything we've done so far has just been the setup. What's coming next is, without a doubt, the single most critical, most sensitive, and most skill-dependent part of the whole procedure. This really is the make or break step. This is decolorization. You're going to tilt the slide and carefully apply the decolorizer, drop by drop. You're literally watching the purple dye run off the slide, and you have to stop the second that runoff is almost clear. The whole thing should only take like 10 to 20 seconds. It's that fast. If you go too long, you'll strip the dye out of everything. Too short, and nothing gets decolorized. It is all about timing and observation. And let me be crystal clear here. This is the #1 mistake. It's what trips up students, new techs, pretty much everyone at some point. If you over-decolorize, you're going to wash that purple stain right out of the gram-positive bacteria, and they'll look pink, falsely gram-negative. And just like that, you've completely invalidated your result. Okay, so once you've successfully navigated that tricky decolorizing step, the rest is pretty straightforward. You just flood the slide with a safranin counterstain for about a minute. This is what's going to stain any of those decolorized cells, your gram-negatives, that nice distinct pink or red. Then you give it a final gentle rinse, carefully blot it dry, and boom, it's ready for the microscope. Actually doing the stain is really only half the battle. The other half is interpretation. Knowing what you're looking at, and, just as important, how to troubleshoot when things don't look right. So now, let's talk about developing that expert's eye. Think of this as your go-to diagnostic tool.
So let's say you look under the scope and everything, everything is pink. Well, the most likely culprit is that you over-decolorized. On the flip side, if it's all still just a sea of deep purple, you probably either didn't decolorize long enough or your smear was way too thick for the reagents to even get in there and do their job. So let me give you a few pro tips to help you nail this with precision every time. First, and I know we've said it before, but it's that important, thin smears are non-negotiable. Second, always use fresh reagents. The old stuff can lose its punch. And when you get to that super critical decolorizing step, do one slide at a time. It's the only way to maintain control. And finally, when you report what you see, be specific. Don't just write down gram-positive. Say gram-positive cocci in clusters. The details matter. And this is why it all matters so much. This story from a seasoned lab scientist just captures the real-world stakes perfectly. So they get a CSF sample, that's cerebrospinal fluid, from the brain and spinal cord, and the stain shows gram-negative rods. That result, right then and there, pointed to a really specific, really dangerous bacteria. It allowed the doctors to completely change the treatment plan for that patient, all within an hour. That's the power of this test. So when you boil it all down, what's the ultimate takeaway? It's this. The gram stain is this amazing balance of precise technical skill on one hand and just massive clinical impact on the other. It's a classic procedure where every single step, but especially that decolorization, directly influences a result that could change everything for a patient. So the next time you prepare a slide, I want you to remember that what you're doing is so much more than just following a protocol. You are providing the first, the fastest, and often the most critical piece of information in a patient's story. So the real question to ask yourself is, what life-saving decision is your next gram stain going to influence?